I'm a family medicine physician. I'm a board certified in family medicine. I will speak in English, so people who speak Russian, люди, которые говорят по-русски, вы можете сгруппироваться, что переводчик вам будет переводить. I will speak in English, so I just say to my fellows who speak Russian so they can sit together. So a translator will translate for them. I work as a hospitalist, as a traveling hospitalist, and also I'm doing moonlighting in urgent care. First time I was introduced to Scenar in 2001. I read in the newspaper about this fairy tale. Oh, there is a magic machine who can treat everything. And as you know, all doctors are skeptical, say, oh, that's kind of fishy. But we're also very curious. So I decided to visit this institution and interview the patient and my own self. So on that time, a Scenar cost annual salary for Russian physician. So it was a lot of money for me to decide to buy it. But, I met a patient, I spoke with them, and the one patient kind of turned my head around. I will tell you her story. This was a 46-year-old female who had a brain injury many years ago. After that, she developed seizures, epilepsy. She was a businesswoman. So she has to work with the numbers, she has to come with the speeches, meetings, and the anti-seizure medications really affect her effectiveness, productiveness. And one time she heard about this magic machine and she decided to use it. Well, unfortunately, when you're treating seizures, on that time you have to shave your hair to achieve a maximum effect. Well, what she's losing? Not much. Hair always regrow, sorry. Sometimes when I speak too fast, I'm kind of swallow the words. Anyway, she had 10 sessions, and at the time when I met her, it was already 2 years, and she was seizure-free. That was her story. On the time when I met her, she was treating cellulitis. So when I believed to her and all patients, I bought the machine, I went to the training, and since I'm been using. So I will share some experience I had in my life and what kind of diseases I treat. So I will tell you the cases. Case number 1, this is a 63-year-old female with a pneumonia. She had an allergy to over 30 antibiotics with an anaphylaxis. So she was scared to use any antibiotic. She scared medical doctors. Well, that was the time when I just started to use a Scenar. So every patient was unique to me. I didn't know, can I help them? I will fail it. I will kill them. And I'm a medical doctor. So that was scary. I say, okay, I will try. So what we use the 3 pathways. I always start with the 3 pathways. But what I do first, and I think that will be good advice. Sometimes we don't have enough time, we skip a time, we do not interview the patient. So my advice to you, always start with an interview. Ask what general problem has the patient, so then you know what you're dealing with. What kind of flare you will have it. Number 2, ask a patient, what do they want to achieve during this treatment and after this treatment? And rule number 3, I always take a patient only with acute disease or flare. If they're on a chronic disease and they're stable, I will never touch them because this will cause a flare and the patient will think that's a Scenar caused it. So, and you know already about homeostasis and why it's happened. But anyway, we started the 3 pathways. I did the bubbles a few times a day. We did the palms, we did work on her belly. Well, and the most important, since I'm a physician, we did the X-ray before and we did the X-ray after. After 7 sessions, her pneumonia gets resolved. Oh my gosh, I was scared. She had a fever, she was sweating, but she was very positive. She believed in me more than I believe in myself. So that was good. So case number 2.
So during this, she didn't receive any other time?
No antibiotics, no Tylenol, nothing. And in fact, I found amazing, and I always tell this to my patients, Tylenol takes 30 minutes to 1 hour to decrease your fever and has a side effects. Ibuprofen is the same. It takes 5 to 10 minutes using a scanner in your armpits in order your fever will go down. You will just perfuse the sweat, you feel better, and no side effects. The most important, no side effects. The first rule as a physician is do not harm. I always remember that. Do not harm. You will help or not, but do not harm. So, case number 2. As Iosif already told how we work with the skin, so I just use the same rules for every patient. So interview first, what to do, and then using a paint, and find a zone of small asymmetry, and then diagnostic 1.
Her question was, what frequency under the armpits?
Oh, so under the armpits, I'm using the modulation. Modulation, so depends, so if you are working with a fever, so it's for acute disease, you can do, modulation 3-2-1, 2-2-1, 1-1. And when you're doing 1-1, I usually do 3 or 5 minutes. You can do, if it's a patient been already ill for a while, you can start not with just 3-1, you go 3-2-1, 3-2-4, 3, what is I'm saying? So you go up and down. So depends, I think it's almost like, I've been told use for acute diseases going just down, 3-1, without going up and down. But I'm using both, so I don't see any harm from that, all individually. But children, of course, they react faster because their nerve system, the nerves that don't have a myelinization completely yet. So that's work much faster, especially in children. They don't like pills, and you don't want to kind of poison your children with it. And the scanner, this is just the best device for them. Any question about this case?
Yes. What frequency are you modulating at? Because you have different frequencies you can modulate.
Okay, so you can use 90.
90? 90.9?
15. I still use the first oldest device, one of the oldest. So mine is like normal resistance 59.9. So and the newest one is 90. So you can use either one.
In what time frame did you do those 7 treatments for that pneumonia?
Well, that was my mom. So I treat her every day.
So for 7 days?
Right.
Okay.
So, but I think she had a mirror reaction in a short day. And what I learned, more acute disease, much faster you will develop a mirror reaction because your body already kind of on the top. You don't need to put much energy, and then only you will just do better and better and better. Which you compare with the chronic diseases, right now you're here, and then you're making a flare. Because, when we treat with antibiotics only suppress the disease. And the scanner, it just makes a homeostasis. So if it's an acute disease, your body is here. It's everything acute. So you just kind of go down. So all patients are so happy. You got a 100% satisfaction. So, kind of remember that. So case number 2. 75-year-old female came with a stroke she had 2 weeks ago. And result of the stroke, she had a left side weakness, and she has a numbness on this side of her body, and then she started developing a contraction in her hand. And more, she had a blindness in her eye. But remember, it was 2 weeks, so it's still kind of acute for stroke. Well, again, I was still working in my first year. Every patient was unique. I said, okay, let's try. So again, I did a zone of small asymmetry. I did the 3 pathways. I work on her hand. So what's happened in the first session? Her hands start feeling in day 1. She says, my gosh, I feel it. That was amazing. So she was happy. I was even more happier. Then contraction is gone after 3 days. So she started moving. She was able to make a fist. Day 7, her eyes start seeing. So I thought she didn't have an atrophy of her nerve. Maybe she has a hematoma in her eye, was a pressure on her optic nerve. So that was amazing. She was so happy. I was even more happier. So that was a very good case. So case number 3, I had a 37-year-old female who had fibroids on her uterine. And she came to me, she was crying, and she says, well, my OBGYN just did an ultrasound and says I need a surgery. Do you think you can help me? I say, I don't know. Let's try. So they say I should, and the scanner should, so let's try. So we did a 7-session. As I've been taught during my training, when you work with the hormonal things, like fibroids, there is no acute complaints. There is no pain most of the time. So we did the 7 sessions before her menstrual period and 7 sessions after. No skipping a day, but when she had a menstrual period, you just skip that time. And when you work with a hormonal system, you have to tell your patient, do not expect a result right away. So you have to do ultrasound or any diagnostic procedures to see what scanner did maybe in 2-3 months. So then it will be the best result. Because body still have a memory. You work, but the body is still working. Homeostasis is still happening in your body. Your body is still cure. You just give it information, kind of wake up your resource in your body, and then body will finish all. So 2-3 months later, she went to her OBGYN. And she, but OBGYN, so any doctors have so many patients, they don't remember who is who and why they came. So she did her ultrasound again, and she says, why did you come to me today? She says, well, 3 months ago you told me I need a surgery. And she says, I can't believe it. I will not believe it if it won't be me who did this ultrasound. But I did it. I have my documentation. And yes, I did say to you that I offer you a surgery. So her fibroids get shrink to the point that she didn't know she doesn't need a surgery anymore. And she never had a surgery. So that was a great result. So again, I work everywhere. So there is not only in the belly. I always start again, 3 pathways. I do a lot of belly, palms, work in the hormonal zones, everywhere, they all. You know what I find out? I had a multiple different level of training in a scanner. But level 1, actually it's enough to do almost the same. Maybe it will take longer, but it will take less time. But you will get a good result. So, and happy patients. Next case. Next case, it's a 4-year-old boy who had an antiviral infection. So when I saw him, he had a fever 101. So for Russian speaking, it's about 40 degrees. Celsius, and he had abdominal pain, diarrhea, he was vomiting. And work with a pediatric patient, with the children, it's initially could be difficult because you have to get this trust. You have to talk with them and let them touch you. So he did not let me touch with the skin. It's a metal. He says, no, 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 no. Okay, I say, how about I will just put my hand on you? Is it okay? He says, okay. So I hold with my hand an electrode of the Scenar, and with my hand, my another palm, I treat him in his armpits, I treat him in his forehead, and I treat him in his belly. Fever went down. The effect the same. It's worked through you. So fever went down, he feel better, abdominal pain resolved, and he starts smiling, and he developed a trust. So with the viruses, sometimes, it just goes like that. So couple hours, his symptoms come back. And that time, he allowed me to use a Scenar and electrodes. So next day, he wake up with no fever, no nausea, no vomiting, and it was just healthy boy. So we were happy. So next case. 46 years alcoholic male with alcoholic pancreatitis. So this guy, he had a binge drinking maybe for 2 weeks, nonstop. And his wife took him to ER. He left ER after 3 hours against of medical advice. But then he was not able to eat. He developed hallucinations. He already going through alcohol withdrawal and plus pancreatitis. He had a fever 104. His wife called me at 10 p.m. and just begged me. And I say, no, 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 no. He left the hospital. I cannot do that. So, but, you never can say no, I guess. I worked on him for 3-4 hours. He was almost unconscious. He was not able to talk. So I work. At this point, I started to work with a smaller symmetry, and then I did a stereognosis on his belly. That's why it took me so long, because I thought, well, that's a complicated case. He's very sick. But after 3-4 hours, when I finished to work on him, he opened his eyes and he says, I want to eat. Do you have some food? His fever was down. So it's taken me another 5 days until he will come back baseline, his pain completely resolved. So, and we did not use any Ativan, no any other medication, not for withdrawal, not for pancreatitis. And if you know, in acute pancreatitis, actually, food is contraindicated because of the enzymes will get activated. But it was a very good result. So next case. Yes. So initially, first time when I bought a Scenar, I did not use a blanket. But then I heard these stories, and I heard that when you use in a blanket and Scenar, you will achieve much faster result and better result. So now, yes, I use for each patient. I use a blanket. So this is a kind of part of Scenar therapy. And in fact, I rarely use a Scenar for myself, as most practitioners probably only something acute. But, I work long hours. I work as a hospital, I work 12 plus hours sometimes a day. And, I just come to home, I'm completely tired, only I have energy, just get to the blanket, fall asleep, get my relaxation tape, and 30 minutes later, or how many minutes, they say 30, but whatever's happened, I wake up and I can move again, and I'm just a brand new penny again. So, so blanket, yes.
How long do you use the blanket for yourself? Because isn't there generally a time limit to use the blanket?
So usually recommend 30 minutes, but usually when I use for myself, I just fall asleep.
In the blanket?
Yes.
All of your body?
Right. So, No, but I don't sleep 8 hours. So I fall asleep and I wake up in 30 minutes, 40 minutes, an hour, whatever I wake up. And right, so. Right, so I think a body knows when you wake up. So no, it's not through the night. So next case, 32 years old female. She developed fibroid cyst in her arm after the insect bite, which is common. Maybe you saw that. So she went to the surgeon and he recommends surgical treatment and remove the cyst. She says, well, you know, I'm a woman. I don't want an extra scar. Do you think we can do that? I say, I don't know. Let's try. I always say that. So we just work only on modulation, and again, cyst went away, not right away. Maybe we had a 10 session, I think 7 to 10, I don't remember exactly, but it's decreased in the size and become completely non-tender on palpation, did not bother her anymore, but it's completely resolved maybe in 1-2 months. Okay. So next case, 34 years old female with onychomycosis. Do you know what everyone knows is it? It's a fungal involvement of the nails. So as medical doctors, we treat a fungal infection of the nail from 3 to 6 months with a Lamictal, which is a very, very hepatotoxic medication. And sometimes it's unsuccessful. And you have to, after 3 months, check your liver enzymes to start a course of Lamictal. So this patient had only 1 toenail involvement, and she had some skin. And sometimes probably I use a scanner off of label because I'm a doctor, I'm a kiddies, I want to try. And I use a Lamictal cream topically. I put around her skin and on her nail. So no nail polish. You have to remove a nail polish. And again, just work on modulations. After 3 sessions, she disappeared. I'm calling her, say, what's happened? You changed your mind? She says, no, that's all gone. I say, really? I can't believe it. I couldn't believe it. So, but she was very happy because I did not promise her anything. I say, I don't know. Next case is 25 years old female with lupus erythematosus. This patient was on chronic steroids. She was taking a prednisone 10 milligrams a day. And she came with a flare, which was good. I was happy that it's a flare. Did I treat lupus before? No. Did I know it will help her? No. I did not promise anything. I said, I don't know, let's try. They say it will. So we start working again. So again, you say, what is it? I do almost the same. So I start what the major complaints they have. Whatever hurts, if it's the joints hurt, you work on more on the joints, find a small asymmetry. Always listen to your patients. Always listen to them. Just, there is be individually because every person is different, so you have to work with each person. And we did the same. We did the 3 pathways. We work a lot on the hormonal zones. We work on her abdomen. We not only take it off her flare, but we decrease the prednisone dose to 5 milligrams from 10.
How much time?
10 sessions. On that time, I was kind of put everyone, I say, you need 10 sessions. Because I didn't know yet. So sometimes it takes less. I mean, they say, I don't need anymore. I feel fine. I get better. But with the scanner, again, there is no magic number. Remember, work with the patient. Get better, you resolve a problem, stop. That's enough. She was happy. She was taking, nobody likes the prednisone side effects. This is people, get the moon face, obesity, and the skin problems. So she was very happy. She was a young girl. So next.
Did you treat any other cases like this?
No, actually, for some reason, there are so different people, such a kind of big diversity with the different diseases. So no, I never treated lupus anymore. But in this point, I just want to tell you, I had one unsuccessful story in my life, only one. And it was a scleroderma. It's also connective tissue disorder, which is autoimmune. There is no medicine which cures scleroderma or lupus in the world. And this girl, she didn't have any active complaints. She has no complaints. She was on her baseline, but she and her husband, they read in the newspaper about it, and they decided to try. And again, I say, I don't know. I mean, I don't think we have to start right now because you have no flare. But he says, she doesn't have a flare, never. We just want to try would it do any difference or not. So we did the 10 sessions, and there was no difference. But again, maybe, I spoke with Ravenko about it case many years later. And he says, well, probably you didn't work, your knowledge wasn't good enough yet to help her. But she was, she wasn't disappointed or anything. It didn't get worse, it didn't get better. This was only one unsuccessful case in my entire life, working with a Scenar. So, next case, dog bite. 2 years ago, I went back to Russia, and I got bit by a dog. So it was the last day. I was actually on my way coming back from Russia to United States. And my dog just kind of, I don't know how he gone from the leash, and he jumped under the truck on the highway. So I tried to get him off from the highway, and he was already in agony, and he bit me because he was in pain. So I had this open wound, dirty, bleeding. I can see my ligaments, and I have no insurance, and I have to go back to United States. I have to take 20 hours of train to Moscow and then fly for 15 hours in the airplane. Oh gosh, that was terrible. But I had my Scenar. What else I need, right? I washed the wound. I put the Scenar on my skin and treated. With modulation, I did just regular treatments. And I just want to show you 2 scars. This scar I got when I was 12 years old, medically treated by the doctors. This is a scar 2 years ago I treated with a Scenar. It was like that. I have actually a person who can confirm, and she saw what kind of wound I had. And since it's almost a lunchtime, and I don't want to take too much attention, you guys are already tired, I'm going to tell you my last case. It was a horse. So I had a friend, she's a medical doctor, she's occupational therapist. She had horses. And I will ask you come here and tell the story. I think you want to hear from the first person who can tell their own story. Betty Ann Cohen.
I don't have to come up there.
Well, you have to, they will not hear you, right?
How many treatments for your dog bite?
Well, since I had my machine, I want to heal it as soon as possible. I just did whatever I feel like. I just did a few in a day.
You had to yell at her every day to do it.
No, but it was after all. I'm talking about an acute. But when it gets better, yes. So I think here's a microphone you can use.
Oh, no, don't go back.
Oh, sorry.
So at the time, Olga happened to be staying at my house and I have horses. And we had 2 injured horses. One my young horse had an accident, had gouged her leg, and about 2 weeks later, in the lower leg, she had about a 3-centimeter hole. It was almost rectangular hole.
Abscess.
It opened up,
It's
and it
become an abscess,
was
yeah.
probably about 2 centimeters deep. And then another horse at my house, Lua, who belonged to a friend of mine, had sustained an injury as well. And that horse had a history of making proud flesh. So she actually got the horse very inexpensive because she had a large lump on her leg from an injury when she was young. And the way she healed was to make a very big scar that stood out. So it was a big blemish. And so Olga treated both horses every day.
Every day.
And they both healed up really well. And the scar on the young horse that makes the big scars is much smaller than the previous one. And my horse healed up a hole in her leg very quickly in the course of about 2 weeks, I guess. And I've been using my scanner since then for musculoskeletal issues with the horses and with my dog for an ACL tear, and they've been very effective.
So horse that Betty Ann had initially had the injury which became an abscess and had maybe like 1 inch or more length hole in her leg. I use a vaginal rectal electrode, and actually I put in this hole, and that's how we treat it. And then after that, we just put a wet, dry dressings and wrapped around. And this hole get completely closed in which time?
A couple of weeks. There
Couple
was
weeks.
a tiny bit that lingered.
It was amazing. That was amazing story. And then it was a time to me to leave from Betty Ann's house, and she says, what I'm gonna do? How I'm gonna do? Who gonna treat me? Who gonna treat my horse? I say, well, I think this is a time for you to get your own device and treat your horses and go to the seminar and treat it. Thank you very much.
Thank you.
So on the end of my presentation, I just want to kind of summarize the rules. Iosif Semikatov already spoke about it. So rule number 1, treat a patient. Number 2, interview a patient. Remember, here and now, if you will just treat acute conditions, you will have successful stories only. So I think that's it. Do you have any questions? So beside that, of course, I treat all...
Yeah, the device you were using, was that the 87.4 all this time, or did you graduate to something else?
Well, I have all attachments. Yes, I have all kind of attachments, but I use a second device, 97.4, 97.5, something like that.
97.5 is the one you can hook up to the computer.
Yes, 97.5, that's what I have.
97.5?
Yes, I do have 97.5. Huh? No. Yes, so this is exactly, I bought a 97.4, and then 6 months later, I drop it, it gets broken, and I upgrade it to 97.5. So, and when I treat a horse, actually horse one time, just kick it out, my device flew a few feet away, still alive. I never upgrade. It's worked great, and you know, well, today or this time, actually, I'm going to buy a new device.
Oh, it's a Russian bear.
It is a Russian bear, and everybody's laugh at my machine, but I love it. I mean, you know.
That's one of the best machines ever made.
Yeah, I think so. I mean, I like it very much, so.
I know you're saying don't treat chronic conditions, but have you ever tried it on fibromyalgia patients?
So fibromyalgia patients, I mean, I'm just saying do not treat chronic conditions where they don't have active complaints. Fibromyalgia patients are very successful stories. You know, fibromyalgia patients are very complicated patients. It's a neurosensory, and the pain mostly inside of the brain, the sensation. That's why a medical doctors, they cannot find a reason why it's happened, and they're not successful on that. But if you will use a Scenar for fibromyalgia, and you don't have to even work in diagnostic 1, and just work on a small asymmetry and use a blanket, I think you will be successful. And I think fibromyalgia patients, you should advise them to get a home on device so they can help them. Because, you know, this is kind of chronic condition. Anything else? Thank you very much. Thank you for listening to me.